Hello, I'm Dr. Walter, working as an assistant professor in SNS College of Physiotherapy. So, I welcome you all to this new part of the video. Today, we are going to see a new topic under the topic heading spinal nerves. Spinal nerves, which plays a major role in day-to-day life for each and every persons. So, how does it place? First of all, while entering into the conditions, we need to learn what is spinal nerves, how many spinal nerves are present in the human body. Spinal nerves are a mixed nerves. What is mixed nerves? It carries both sensory and also the motor. So it carries the motor and the sensory. In other hand, it gives the autonomic signals between the spinal cord to the body. Okay. So end of this video, we will be learning how does this autonomic signals is transmitted. Now it is essential for the control of the body parts. So these are the basic intro for the spinal nerves. Now look at this diagram, which we can see an imaginary diagram of the spinal cord and the corresponding nerves. Okay, spinal nerve, ventris ramus, this is the ventral root and the dorsal root, and these things which we have learned already in the anatomical part. Spinal nerves, how many nerves are there? What are the subdivisions of the spinal nerves? We are going to see right now. Now look at the slide. So we are having 31 pairs of the spinal nerves. Okay, 31 pairs. What do you mean by pairs? 31 pairs means we are having 62 spinal nerves. So one set of 31 will be going for the right side, one set of 31 will be going for left side. So this will be a equal distribution in the spinal cord based on the segment wise of the spinal areas. What are the segmental wise? Now we are going to see the segmental wise. First segment is going for the cervical nerves. Cervical nerves will be going for C1 to C8, but we are having the bone value of C1 to C7 only. How does this one extra nerve is arising in this area? For this clarification, I'll let you know one part of the nerve will be locked onto the occipital region and it will be a supporting nerve, and from C2 to C8 it is the nerves which will be supplying to the neck region. Okay, cervical is going for the neck region. So which and all areas it is supplying? The muscles of the neck, skin over the head, chest, and some extrinsic muscles of the chest. Onto the upper part of the body, it is going for the supply, cervical nerves. Going for the next heading is going for thoracic nerves. Thoracic nerves starting from T1 to T12. 12 pairs of thoracic nerves. How does we can define? How does we can learn in simple? We are having 12 pairs of ribs, and posterior side these pairs of ribs are connected with the thoracic vertebra. How many ribs are there? 12 ribs. So how many thoracic vertebra will be there? 12 vertebra bones will be there, and for this conclusion we are having 12 pairs of ribs and 12 pairs of spinal nerves. And where does this supply? It supplies to the chest, intricate muscles of the thoracolumbar region. Thoracolumbar region means thorax and combination with the lumbar area, that is the low back area, and also supplies to the abdomen and the axilla. Abdomen area and the corresponding organs which are present inside the abdomen, and also to the axillary area. Now we are going for the lumbar nerves. Lumbar nerves, which we might know earlier itself, because these nerves are only small. How much? L1 to L5. But these nerves plays a major role in the low back pain and the corresponding problems. Okay, first L1 to L5, where does it supplies? It supplies to the abdomen, pelvis, and some of the muscles of the thigh region also. Look, lumbar nerves which is traveling to the, and nerves which are traveling to the thigh region also. So the greater impact is going for the lumbar region, and it will be supplying to the abdominal region, back, and anterior thigh, and to the inguinal area. So this lumbar plays a major role among all the thoracic and the cervical and the corresponding spinal segments. This is most important. Why lumbar is most important compared with other nerves? Other nerves also important, but this lumbar, it will be supplying to the lower back region, and this area is going for the low back pain. If a disc between the two bones going for disc dehydration, disc prolapse, or disc protrusion, it will be affecting the lumbar nerves, and this will induce the low back pain and the corresponding problems. Going for the sacral nerves. Sacral nerves, which we know, it is S1 to S5. This plays an important role in the center of gravity. Center of gravity we have learned already in the basic physics and in also to the other areas. Center of gravity means a body's center point will be considered as the center of gravity. For the human body, center of gravity is going for sacrum 2, and this sacrum 2 is playing a major role in maintaining our body posture standing erect. While we are walking, body posture is erect. While we are sitting and listening to the classes, body posture is erect. All these going for the sacrum 2. Where does these nerves gives the supply? It gives mostly to the skin, muscles, joints of the lower limbs, lower limb joint, hip joint, knee joint, and the ankle joint. And it gives from the sacral nerves. We are having a plexus there, and from that it is going for the other areas, and also to the pelvic region areas. It also supplies to the muscles which are present in the pelvic region. Pelvic region is most important for the females. Why it is most important for females? The child barrier. In these conditions, these nerves may plays a major role. Now going for the last one, that is the coccygeal nerve. Coccygeal nerve, it is considered as C01. What is 1? Yes, we are having one coccygeal nerve. Okay, and where does it arises from? It is arising from the tapering part. What is tapering part? It is the last area, the end area of the spinal cord. From there, it is getting arised and it is transferred to the skin over the coccyx region. And mainly, you need to understand this coccygeal nerve will not supply to any part of the body, no distribution to the body. Now, we have learned all these things: cervical, thoracic, lumbar, sacrum, and the coccygeal region. 31 pairs of spinal nerves. In applied anatomy, we are going to learn if a patient is going for any type of lower back pain or cervical neck pain. These nerves plays a major role in the pain area. If a patient is having cervical pain, he is undergoing the area that cervical nerve is getting disturbed, or the muscles which are getting the cervical nerve are getting disturbed. So when we are coming for the physiotherapy management, we can able to regularize the pain and we can improve the range of motion. And in this video, we have learnt about the spinal nerves, segments of spinal nerves, and the distribution to the particular area. We can meet in next video in a new topic. Thank you.